Contents in the box. The instruction for use. The test cassette foil bag. The sterile swab. The extraction tube and cap. The buffer. The certificate of conformity. Wash your hands before starting the procedure. Take out the contents in the box and place them flat out on the table. Insert the extraction tube into the small hole on the back of the box. Unscrew the lid of the buffer, and add all of the buffer into the extraction tube. Remove the sterile swab from the packing. Avoid touching the tip of the swab. Keep upright position. Insert the tip of the swab into the left nostril and gently push the swab until a slight resistance is felt. Then rotate the swab in circular motion for 15 seconds. Remove the swab from the left nostril and repeat the same procedure in right nostril. When finished, remove the swab from the nostril and place the tip of the swab into the extraction tube. Rotate the swab in the extraction tube for about 10 seconds, pressing the tip against the inside of the extraction tube to release the possible antigen on the swab. While removing the swab, squeeze the side of the extraction tube against the tip of the swab to expel as much liquid as possible from the swab. Put the cap on the extraction tube. Open the foil bag and take out the test cassette. Place the test cassette on an even surface. Transfer 3 drops of the liquid in the extraction tube into the specimen well of the test cassette. Start the timer and read the result within 15 minutes. Do not interpret the result after 20 minutes. Result interpretation. Interpret the result within 15 minutes. Positive. Both the control line and the test line appear on the membrane. A faint test line still indicates positive result. Negative. Only the control line appears on the membrane. The test line does not appear. Invalid. The control line does not appear. Another test is required. For positive COVID-19 results, if you are tested positive, follow the current Department of Health and Aged Care advice. For example, if you have a COVID-19 positive result, staying at home protects the people in your community and you should not visit high-risk settings like hospitals and aged and disability care settings. If you feel unwell or need COVID-19 advice for someone in your care, talk with your health provider, or speak to a nurse by calling the Health Direct helpline on 1-800-02222. If you develop symptoms such as severe shortness of breath or chest pain, call 000 immediately. For invalid results, please repeat testing using a freshly collected sample and new test cassette. Report repeated invalid results to the sponsor.